Hi, everybody. As he said, my name is Aleta, and I identify as female. She, her, hers, and brown. And amongst many other attributes, titles, roles, my most favorite of them all is that I'm a mom. And I'll never forget the moment I became a mom, because my life has not been the same since. It's true, gestation really does impact every organ in the woman's body. But more importantly, it changes your purpose. I'm the CEO of Masters of Maternity, and I'm also vice president and founding mother of the Pennsylvania Doula Commission. And aside from my maternal roles, yes, I am a certified agile product owner and vice president at the largest custodian in the world, and then I'm a wife. And I added wife there because poor husband of mine, it takes a ton of support to commit to all of these roles in excellence. But the rest of my story, to be honest with you, is pretty boring, but I'll tell it. My daughter, she was born via emergency cesarean, but not because I had any real complications, right? Because no matter how hard I tried to get her into this head down position, she refused. She wanted to be born either sitting or standing up. And so I labored with her all the way up until I got to about 7 centimeters, naturally thought I was doing something, and then she turned. And for the third time, she turned. And so I birthed her abdominally. And then my son, he was born vaginally. And in the birthing world, this is a huge accomplishment, right? They term this VBAC, for vaginal birth after cesarean. I had to labor with him for over 70 hours to bring him earthside. I mean, it was worth it. He still requires just as much effort, if not more. Except now he's one and super bossy and all that fun stuff, right? And both of these moments, both of these births, included and required a doula, a midwife, a lactation consultant, and my husband. And ultimately, I'm proud of both of these experiences because one, well, I had to make some of the most challenging decisions that I've ever made in my life. Two, I had to work the hardest I've ever worked, both mentally and physically. Three, listen, I know I'm biased, but I birthed some of the most beautiful, tiny little humans in the world. Four, it was in these moments that defined who I am and my why. But five, I survived. You see, birthing isn't just a miracle at conception. I always say, my deliveries were the closest I've ever gotten to death. Why is that? Well, let's talk about it. Let's reflect. In Ghana, they call this a Sankofa moment, meaning in order to move forward, you must first reflect on the past. Will you reflect with me? In the 1800s, most women birthed at home with friends and family. They call them doulas, midwives, predominantly women assisting women, and it was a normal, yet a very knowingly dangerous occurrence. And, although these women knew that it was dangerous, they still decided to pursue having many children. The maternal mortality rate was much higher than it is today. 1 out of 8 women died, and women prepared for death in preparation for birthing, and often referred to birthing as their time of trial. In other words, they wrote their wills before birth. It's pretty frightening. You got to think about how far we've come as women in this world, from an employment perspective, an opportunity perspective, from our freedoms. And then something revolutionary happened in the 1900s, and that was the emergence of medicine, a considerably progressive era. So much medicine was introduced that providers thought it would be a good idea to put the mother to sleep during the entire duration of their delivery. So what does that mean, right? Yeah, they gave the mom medicine, the birthing person medicine, to speed up their delivery so that they had their baby on their time, to force dilation, then give them an episiotomy, so they cut the opening of their vagina to help with the assistance of delivering the baby. And then to deliver the baby, they used forceps. By the time the mother woke up, they didn't remember a thing, right? This was called the twilight sleep. It's also worth noting that during this time, birthing in a hospital was considered a privilege. and that the midwife, the traditional midwife, was viewed as a lower class option and basically replaced by male obstetricians. You see, childbirth is and was our battleground, because just like babies are being conceived right now, birthed right now, they're dying right now too, right? Unnecessarily. Birthing mothers are dying right now. Unfortunately, it's still a normal, yet dangerous, occurrence. It's a crisis. Now, if dying while birthing isn't new, why is it still happening? I'm confused too. Don't get me wrong. So listen, let's level set first. There is a maternal crisis happening right now. It's just not news. In fact, over 500,000 women are estimated to die every year worldwide because of pregnancy-related issues. If we drill down to a national level, in 2019, over 600 women died. In 2018, over 600 women died. In 2019, over 700 women died. And then in 2020, over 800 women died. So over the pandemic, right, those were basically the last few years, we noticed an increase, a spike. And that's how this maternal crisis rose to the surface. But if we take a look at where we are right here in Pennsylvania, 1/10 of those deaths happen here. Pennsylvania has a higher maternal mortality rate than the entire nation, sitting at about 18.6 per 100,000 lab births. These numbers, these deaths, are in fact entirely, most of them are entirely preventable, 60% of them. So, and some people say 80%, depending on what research you find. So let's think about it. In 2020, out of those 861 women, over 500 of them could still be here. Which brings me to my first issue with this maternal mortality crisis. Death is just the tip of the iceberg. The fact that the vast majority of these deaths can be prevented leads me to believe that there are many underlying issues that have yet to be solved. Where's the emphasis and the focus on the near misses? The people who didn't die but had adverse outcomes. The issues that we're aware of. The maternal mortality rate historically is known as an indicator to measure the quality of maternal care. And as you can see, in comparison to other developed nations, and we spend the most on healthcare, we are miserably failing our mothers. And the Healthy People 2020 agenda, which, by the way, was launched in 2010, again, this isn't news, you actually listed on their agenda. So this Healthy People 2020 agenda was set out to build a healthier nation, right? They listed the reduction of maternal mortalities as a priority, but it's only increased since then. However, I digress, right? We haven't always measured maternal mortality rates. Okay, wait. We haven't always measured maternal mortality rates well, right? Or as accurately as we do today, and they are still flawed. Why is that? Well, because classifying the cause of death can be challenging, let alone measuring them. And so oftentimes maternal deaths were misclassified, and thus, as a result, they weren't measured. There were people who were not counted in those counts or in those results and in that data. And so the government identified a gap. They needed help measuring it. So in 1999, the International Classification of Diseases, which you may know as ICD codes, expanded to include common pregnancy-related issues. 1999. And 4 years later, so now we're talking about 2003, there was a pregnancy checkbox added to death certificates. So they use this pregnancy checkbox to basically say, now we can actually point the cause of death, those ICD codes, to being pregnancy-related. Makes me think, so what were we doing before? And they noticed that there were some discrepancies. In fact, the numbers tell you 39 to 93% of underreported maternal deaths, but that number makes me uncomfortable. That's a large gap. Point being, there were a large number of discrepancies. And so This seemingly small implementation was so drastic, adding a pregnancy checkbox to our U.S. standard certificate of death, so drastic that the National Center for Health Statistics discontinued their national maternal mortality rates, official public records, from 2007 all the way until 2018. Discontinued them. So if you're looking for the data, that's where it went. They discontinued it. The data's not there. So here's my stance on it. Is it possible that the rising trend in maternal mortality rates was entirely an artifact of changes in maternal death recording? That's even worse in my opinion. So now we know people who are dying from doing something completely natural, but they're also preventable. They're also happening at alarming rates and misreported. They're not even getting recorded correctly. Which brings me to my third issue. Like I said, I identify proudly as being brown. It's racism. Our nation's #1 birth defect. Some people might argue that is sexism. Can we have two? Because they're both very relevant. The maternal mortality rate for Black women is 3 to 4 times more than it is for white women. And these women that are dying, they're not just poor or lacking access to health care or resources. They are legends, Olympic tennis champions, billionaires. They are pilots, speak 4 languages fluently, epidemiologists. They have more degrees than a thermometer. And me? Sure, I'm here to tell my story, right? But those women who didn't die, the Beyoncés, the Serena Williams, they're survivors. They're survivors. And those who did, rest in peace, Kara Johnson and Dr. Irving. You see, you and I have 99.9% of the same genetic makeup. And that 0.1% is enough to let me die or ignore the signs. And I'd be remiss not to tell the story of the hidden voices, the women who were enslaved and experimented on by Dr. Sims, whom I refuse to call the father of gynecology, or the women who were sterilized by force. Just a few stories that are causes for a lack in the healthcare system. Did you know that they really taught providers that we can endure more pain because we're brown in exchange of dying? That's the variation. We endured pain in exchange of, fear of losing our children. Or replace that with anything that is the worst case scenario for you. So did it look like we endured more pain? Or were we just in more pain? Again, ignoring the facts. We know that Black women are twice as likely to lose their babies. They have the highest infant mortality rate. They're more prone to cardiovascular disease. They're more prone to diabetes. Their social determinants of health may lead to more adverse outcomes in the end. We know these things. They've been happening for decades. Why aren't we doing anything about it? Well, hear me out. NASA might be onto something. Did I tell you I like technology and science? So NASA has surveyed the entire solar system, right? And they identified 95% of potential hazardous asteroids. And the other 5% they're working on, and any potential blind spots, they're working to identify those too. Not only do they track these objects, these asteroids, they can purposely redirect the trajectory of an asteroid. And sure, some of these objects, they catch NASA staff off guard, and it's not uncommon for these asteroids to impact Earth, but most times they just create a light show in the atmosphere. And then other times, you better believe NASA is prepared for worst case scenario. The key to this is to track the risk. Well, first you identify the objects, track the risk, identify them, and measure them, and then identify plan a redirection plan in far as advanced as possible. Boom. Planetary defense. And birth doesn't even require rocket science or NASA. We want early detection. How about instead of waiting for a diagnosis, we have precision medicine and biomarkers in place. We can identify these things. We can categorize these things. We can track the risk. We can redirect the trajectory of genetics. You think I'm smart? Research epigenetics. So no rocket science, but we are flush with good science. It's going to take legislation and specifically policies that don't disenfranchise women who look like me and our children. It's going to take employers to care about women, to prioritize women in their roles. And men, we need your support. It's going to take insurers. You want to talk money? The ROI is obvious. I speak that language too. Look up cesarean birth costs and vaginal births. The hospitals, the insurers, we need them on board. It's going to take you to care enough about the woman's reproductive system to provide us with and prioritize end-to-end wraparound care at an accessible rate for all women, brown, white, yellow, Asian, Hispanic, whatever it is. You know, we're just the mothers of our nation. This is much bigger than me. If we can't change the birth of our nation, we can change the birth in our nation if we work hard to recognize the systemic issues in our healthcare system. Will you work on that with me? Thank you.